CPT JJ-CPV Introduction, page 13, part 1.
Selection of procedure, continue.
Continue. Instructions typically included as parenthetical notes with selected codes indicate that a code should not be reported with another code or codes. So all this theory part is telling you is that just be careful to read all the instructions, right? These instructions, as you part.
These instructions are intended to prevent errors of significant probability and are not all inclusive.
They are not all inclusive, right? There's some exceptions, that's what it means. So we just highlight that instructions indicate codes that should not be reported with other codes. So read the instructions. That's the basic message you get from this. When there's a code, read the instructions. Okay? So that's our theory for today. Now let's do a problem. So ready, set, go. Okay, CPT JJ-RVA, page 259, exercise 86, and this is a level 1 exercise, and it reads like this.
Surgery, urinary system. Male patient has been diagnosed with benign prostatic hypertrophy and undergoes a transurethral destruction of the prostate by radiofrequency thermotherapy.
That's right. It's the surgery section of the CPT manual, and it's the urinary system. The male patient has been diagnosed with benign prostatic hypertrophy and undergoes a transurethral destruction of the prostate by radiofrequency thermotherapy. Okay, so that's the procedure. Now we're going to count to 3, so you can stop the video or pause the video and give us the CPT code for this procedure. 1, 2, 3. Okay, the answer is 53852. You got that? If you got it, congratulations. If you didn't get it, let's give you a couple of tips. Tip 1.
Start with destruction, prostate tissue.
Okay, you start with destruction first. You go to the index and look for destruction. Then the next step is prostate tissue. Right? Why not destruction and prostate? Because when you analyze the index, you're going to find this. For prostate, there's one code. Destruction of prostate is one code. For destruction of prostate tissue, there are subdivisions. There's transurethral and there's thermotherapy, exactly what we need. So that's why we choose prostate tissue instead of just prostate. And then they give you a range of codes that you have to investigate. Okay, that's why we chose the destruction prostate tissue. Okay, and the second tip is that.
Second tip, there is no 53851.
Right, they give you a range of 3 codes, 50, 51, and 52, but don't bother looking for 51, but it doesn't exist, right? So with these 2 tips, you should be able to give us the path now. You know the tips, you know the answer. The answer is 53852. Now we're going to count that to 3 so you can pause the video and give us the path or the way that you got to the answer, okay? So 1, 2, 3. Okay, let's read the whole summary of the problem. This is a surgery section of the CPT code. Is the urinary system. It's a male patient has been diagnosed with benign prostatic hypertrophy and undergoes a transurethral destruction of the prostate by radiofrequency thermotherapy. Okay, that's the procedure. There's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to destruction.
Go to destruction.
Then you go to prostate tissue.
Go to prostate tissue. We told you in the tips why. And then you go to?
Transurethral.
Transurethral means through the urethra, right? And then urethral is spelled wrong.
Urethral.
Is without E. Urethral.
Oh, right.
Sorry. There, urethral, okay? And then is thermotherapy, right?
Right.
And then they give you a range of codes, right?
Yes.
Which is 53850 through 53852. That's what you get from the index, right? Now we're going to check this in the tabular. So the code 1 through the tabular is found like this.
53850 is transurethral destruction of prostate tissue by microwave thermotherapy.
Right. The way that you do is you go to the tabula and you examine the 3 codes that they have given you, right? There's a range of 3 codes. So the first one is by microwave thermotherapy. I don't think we want that because there's no microwave in there. So let's look for 51. There's no 51. So we told you in the tips there's no 51. So we're just going to look at 52. What's 52?
And that is
The same thing,
but by radiofrequency thermotherapy.
Thermotherapy, which is exactly what we need. Radiofrequency thermotherapy. That's why there's an equal sign at the end, and the answer is 53852. Okay? Thanks for watching, and please don't forget to visit our website, and also
you can subscribe to us in YouTube by clicking here for our new medical coding videos.
right, just the red rectangle that says subscribe. You just click there and you'll be subscribed to our videos, and you will get
up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, so thanks for watching again, and then don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.